guys, I'm Dr. Iraniha from Surgical Oasis Institute. Today I want to talk to you about tummy tuck, and this is a very common procedure. I get a lot of questions from my patients in regards to this procedure. But before we define the tummy tuck and see what exactly this procedure will address, we need to know exactly what are the problems that people are concerned. So tummy tuck will address three major problems. One is extra fat deposits in the abdominal wall area. Number two is extra skin or loose skin. And number three, muscle laxity, which is usually associated with whether diastasis of rectus muscle or abdominal wall hernia. Now, the process of aging and changes in our hormones cause these type of abnormalities around our abdominal wall area. And obviously, we have very focal deposits of fat, extra fat, or we develop loose skin gradually. And then people who had multiple pregnancies, obviously, they develop a lot of muscle laxity that they never go back to normal. They also can be associated with diastasis of rectus muscle, which is a separation of the abdominal wall muscles in the front, which majority of times is associated with some sort of an abdominal wall hernia. Those create a very unsightly abdomen and make them very uncomfortable, and abdominoplasty or tummy tuck is a procedure that we are offer the patient to basically solve and resolve those issues. So in this patient, you can see this lady had multiple pregnancies, and as you can see, there's an area of the fat deposits in the upper and lower abdomen, as well as the flank area with very loose skin, and actually a lot of changes in the skin quality associated with the pregnancy or being overweight. And these abnormality of the skin, as well as these fat issues that we can solve with the abdominoplasty. As you can see, when you stretch the abdominal wall during the pregnancy or during the obesity, these muscles, even after you lose a lot of weight or after delivery of the baby, majority of times they don't come back to normal, and somehow we need to fix that issue. So the abdominoplasty address that. The way we do the surgery, we make incisions in the lower abdomen, usually in the bikini area, and the extent of this incision really related to how much extra skin and muscle laxity they have. And then we separate the skin off of the abdominal wall all the way up to the rib cage, and then we have opportunity to see the abdominal wall muscles. And obviously, those loose muscles associated with the diastasis or hernia, we usually fix by sewing the muscle together and folding them over each other, or tuck those muscles with the absorbable sutures, and then make the abdominal wall very tight. And that also gives you a curve on the side that you lose majority of times because of the muscle laxity. Then we pull the skin down and cut the extra skin, and then we sew the skin back into the lower abdomen. That way you have a very flat abdominal wall, and that's called tummy tuck. Now, in this process, we got to do something about the umbilicus. So the umbilicus normally is the issues that we need to solve in the abdominoplasty. So a lot of times when we have extreme extra skin, when we have the chance of pulling the skin all the way from the level of the umbilicus to the lower abdomen, then what we do is we separate the umbilicus by making incision around the umbilicus and leave the umbilicus attached to the abdominal wall, and then we pull the skin, cut the extra skin, which includes the scar tissues and also those stretch marks, And then we pull this upper abdominal region, which we call it the upper abdominal flap, and bring it down all the way to the lower abdomen and stitch to that area. And in this new abdominal flap, we create a small incision, and we bring the umbilicus, which is already attached to the abdominal wall, and get circulation from that area to the new skin flap and redo the umbilicus. So that usually happens in full abdominoplasty. Now, during that process, we usually do a limited liposuction to clear these extra fat on the upper abdomen and in the flank region to make the incision very flat and nice, hidden in the bikini area, and also make this flap thinner so you don't have any step off in the lower abdomen. Now, sometimes we don't have that much extra skin in the patients. They have a little loose skin, but it's not as much to completely remove this portion of the abdominal wall. Then we, after we tighten the muscle, we pull the skin as much as we can, but leaving the umbilicus attached to the flap and reconnecting it again to the muscle in the lower abdomen. That way your umbilicus goes down a little bit, but it usually in the level that is acceptable from the aesthetic standpoint. So that's called mini abdominoplasty. So essentially, mini abdominoplasty and abdominoplasty is exactly the same as far as the dissection and how much we dissect all the way to the abdominal wall, and also how we fix the muscle laxity and how we tighten the abdominal wall. The only difference between the mini abdominoplasty and abdominoplasty is the extra skin and what we do with the umbilicus. So again, in summary, in abdominoplasty, full abdominoplasty, we completely excise the umbilicus, leave it to the abdominal wall, pull the skin down and recreate the umbilicus again in the new skin flap. But in the mini abdominoplasty, we cut the umbilicus from the abdominal wall and pull it down and reconnect your umbilicus back to the abdominal wall muscles. So that's the difference between mini abdominoplasty and abdominoplasty. So by doing that, we solve the extra fat, excess skin, and also muscle laxity all together. And obviously during that process, if the patient has any type of abdominal wall hernia, we can also fix that. Now the other question is whether we use mesh or not if the patient has hernia. It really depends on the size of the hernia. If the patient has a very, very large abdominal wall hernia and the muscles are very thin, so pulling the muscle together and folding them over each other might not be adequate to fix the hernia, then we use the absorbable mesh in that area. That's very, very uncommon to happen, but it can. So it really depends on the size of hernia. But if the hernia is not as big, whether the diastasis of rectus muscle or hernia is small, that we can pull the muscle nicely together and I can feel very comfortable that this will not come back, then we do not necessarily need to use a mesh. We never use permanent mesh in the abdominal wall hernia repair with abdominoplasty unless patient has massive defect of the abdominal wall and there's no muscle to bring and close. In that time, we need to bridge the muscle with some sort of a permanent mesh so the hernia does not come back. And again, those are very low number of patients. So majority of patients will be able to perform the tummy tuck or abdominoplasty without using mesh. So if you have any other question about the tummy tuck or abdominoplasty, please contact my office at 949-646-8444. I'll be happy to talk to you over the phone or do virtual consultations or we can have you come into the office for free consultations.